to the CDC, a range of symptoms still linger in nearly 1 in 5 American adults. Those symptoms are debilitating, painful, and life-altering.
The most common symptoms are fatigue, fever, respiratory problems, heart palpitations, digestive issues, and post-exertional malaise. Most people also report neurological problems, brain fog, headache, dizziness, pin and needle feelings, and sleep top the list.
So we're talking shortness of breath. We're talking chest pains. We're talking chest tightness. We're talking intense, debilitating headaches.
It just felt like I couldn't take a full breath in. And my head felt like I didn't have enough air. Honestly, I can't believe this is still happening 11 months later. I can't do anything that I want to do.
I have difficulty sometimes focusing. I have difficulty sometimes coming up with a word that I'm looking for. Sometimes I fail to recognize common objects.
When I tried to go back to work, I got physically sick. The lymph nodes, the exhaustion, the fever, achiness, and that's what happens when I overexert myself.
I wasn't teaching. I couldn't stand up. I could hardly move my body. I was nauseous all the time. I couldn't poop. I could hardly pee. I wanted to die. Many days I still can't even get out of bed. I now have chronic migraines. I can't walk very far at all without running out of breath. I'm constantly getting dizzy. I'm constantly having to go to the ER because I've fallen somewhere. My joints hurt all the time, all the time.
Hi everyone, this is Alex, and I am back with this program, and we've decided to come to a panel here, a panel of people that are made up in North America. Danny Haiphong, welcome to the program. It's great to see you. I guess the state of New York, is that correct?
Yes.
And we'll be bringing Kirk Apesland onto the program here in the moment. There he is, sliding into his seat. Welcome to the show, Kirk. Thank you so much for joining us. We have a lot to unpack here over the next maybe 30 minutes here. In the United States, we've seen protests, but those have been pretty much squashed by the media. There was one in the September of 2022 and May of 2023 demanding more be done about long COVID.
The people that you see today are living with long COVID. They're living with ME, which stands for myalgic encephalomyelitis. These are our allies, our family, our friends who are here to support us. We have been put in a position where we have no other option but to risk arrest for our lives. We have begged the government for decades to do something about ME. And because they did not do what they were supposed to do, we are in this space where millions upon millions of more people are disabled. In March of 2020, the ME community said, we know what's about to happen. We knew people were going to get COVID and we're never going to get better.
We reported on it many times. Sometimes our voices were silenced, actually. Even when we tried to alert the world what was going on this part of the world or that part of the world, again, always met with challenges to try to get that message out. As I know, Kirk, you've been covering a lot of this from many angles, from a geopolitical angle as well as a real life angle, sharing your stories with people. Danny, I was watching you for the entire last couple of years, and your channel is building. And the reason why these channels are growing is people, they've had enough. They want the truth. They want to hear it from people that either have experienced it or people that have gone through it. Danny, you're moving up in the ranks in journalism, getting the invitations with the UN. Is that correct?
Yes, I was able to give a briefing on August 17th at the UN Security Council on the dangers that the ongoing arming by the west of Ukraine poses to the dangers that it poses to global peace and stability. And I was able to speak on it.
I now give the floor to Mr. Danny Haiphong.
Today, I'm here as a journalist who has dedicated the last 10 years of my life writing about and speaking out against the long record of human rights abuses and war crimes committed by my country of birth, the United States. I don't consider this a hobby or even a profession, but rather a duty to all of humanity and those who want to see a better and more peaceful future.
Danny, you were in New York around this time when the pandemic was ripping its way through the United States. How did America handle this, or did it handle it?
Well, the response from the United States was haphazard, to say the least, and what it was really all about was institutional neglect. The United States has been on a journey, what could be called a downward spiral, a race to the bottom, and this has meant that public services, the public sector, healthcare in general, has all come under the dominion of large corporations, monopolies, essentially private hands. And what this meant for COVID was that when there was a public health crisis, there was not an institutional or organizational capability to really rein in and prevent excess deaths. So we had so many needless deaths occur because there's so much disorganization, and to be fair, not enough of a response, especially in the beginning when there wasn't a lot known about COVID-19. And there was, though, a lot of scapegoating, especially around China. That was kind of how the response shaped out, especially in those early months, blaming China for the virus while the virus was actually doing a lot of damage to people's lives. And then there was the factor of when a response did happen, people struggled and suffered mightily economically as they were trying to navigate largely on their own how to get a test, how to get a mask, how to get anything they needed. It was really pandemonium and a lot of chaos, and it surely is a memory that I think a lot of people would like to forget.
Well, let's go over to Kurt. Kurt, you arrived in the shores in North America there. Maybe you could share your encounters. What measures were in place when you arrived, when they knew? And of course, America and Canada, they were definitely giving plenty of time to get their borders ready, medical people ready. If something was of this nature going to spread, was Canada ready when you arrived?
Yes, Canada did fairly good during the pandemic. We didn't take a page out of the American book when the federal government, Trump, said, well, it's just a cold. We've got the best healthcare workers in the world. We don't have to worry about anything. And people followed their leaders. With a president like Trump at that time, he didn't take it seriously, so the rest of the country didn't take it seriously. They had months and months to look at it and decide policy and procedures and all of these things that should have went into place, but they didn't do that. And then when things started to fall apart, then the federal government said, well, the states are responsible for healthcare. No, we're passing the buck. And then you get to 5 million cases in August of 2020. That's like 25% of the whole world's population in the United States. So not doing what they were supposed to. This obviously filtered across the border into Canada. And so it was something that we had to deal with too. Then see August 9th, Sturgis started to get 250,000 bikers converging on Sturgis of 7,000 people. And there's no masks, there's no social distancing. You had the spring breaks in Southern California and Southern Florida, and nobody seemed to take it seriously. And when it's spread like wildfire, well, it got out of control and basically just let it roll through the country. And Danny's right, that the people that were sort of left out of the healthcare system, there's 85 million people that don't have the insurance that they need to deal with this stuff. Now, what do? They're sort of in that position that there's no mass testing, no quarantine, no social distancing. People in the States that say, you can't make me wear a mask. See, Trump didn't wear a mask. He refused to wear a mask. You take it from the leaders. The leaders tell you this, and then there's at least 50% of the population in the United States listens to Donald Trump when he was president. So there was total breakdown of how things were supposed to work in the United States. And it shows in the 1 million plus dead people because of COVID. That's what I saw as a Canadian.
Danny, I'm going to ask you, and thank you for sharing that, Kurt. Danny, was this mostly focused on, the breakdown of the healthcare, or was there any issues with minorities in the United States? Were they getting healthcare as well? I don't really want to use that word, but let's use it anyway. Was there any discrimination?
The White House is just now saying that the president has just signed a bill that will end the national emergency declared during the COVID pandemic.
Once this national COVID emergency ends, a lot of things that are tied up in sort of the justification for how they were done when it comes to things like Medicare, different kinds of health insurance, certain things that were available and that people could take advantage of will no longer exist.
We're bringing agencies together to make sure Americans with long COVID who have a disability have access to the rights and resources that are due under the disability law.
The COVID-19 long hauler advocacy group alone has gathered more than 13,000 patients, many of them struggling to find treatment and access to disability benefits. Even when President Biden announced more than a year ago that long COVID would be considered a disability, and the CDC recently announcing that 4 in 5 people with long COVID have trouble performing everyday activities.
Very difficult time accessing disability. Generally speaking, it can take up to 2 years. It's a long, extenuated process, especially with complex chronic illnesses like long COVID, where medical documentation is really difficult to achieve. Generally, it's about an 80% denial rate in the first round, and that was before the pandemic. So I expect that we're only going to see those numbers get worse as time goes on. Lack of belief, lack of ability to document their illness, lack of medical care providers that are specializing in that illness or even understand what they're looking at. Long COVID is absolutely a mass disabling event. If you're looking at a potential impact of 8 million people becoming chronically disabled, that is a mass exodus from the workforce and a mass disabling event.
Not a lot of resources for us right now. What does it look like for single parents like myself, who are the only breadwinners in the family, who are now unable to work but are not qualifying for Social Security disability?
As a woman and as a Black woman, I understand the history of discrimination when it comes to healthcare in this country, but I never really quite knew until it knocked on my door. Well, damn, if this is happening to me and I have health insurance and I have a career, then I can't imagine what is happening to another woman who looks like me.
You see a lot of horror stories out there of people, who are now unemployed. Other day I got a message from a patient. She said, I'm now homeless, and it's heartbreaking.
Well, in the United States, and in particular big cities, but really all across the United States, there is just out and out racial discrimination. And this is just proven in the data. You look at any indicator socially, economically, generally have it at least double as bad on all social indicators. Just take African Americans were 3 times as likely to get COVID, and they were 1.5 to 2 times more likely to die from COVID-19. And they suffered the brunt of the effects of COVID-19. They've died at higher rates. They have higher rates of long COVID. They also were affected more economically because despite the fact that they had to keep working, a lot of them ended up in situations where they were actually losing even more wealth than perhaps they already were because of the economic dislocation, the economic crisis. That is always going to be a huge problem. Anytime there is any kind of massive change, any kind of public health crisis as a whole, economic crisis, you can bet that ethnic minorities, people of color, they are going to feel the brunt of the effects, because that is how the United States has been organized, not just for decades, but really for centuries since its inception.
Well, that's some excellent coverage. Danny, you said that there is a distribution of wealth. I have to agree on this one. Kirk, we've talked about this kind of thing happening. Big names managed to make big profits during this time. Your experience with that?
The small people got burnt. The big people reaped the rewards of the pandemic. They only opened certain stores. Only certain places were good. You can't get COVID in Walmart. No. Or Superstore or the big box outlets. But you can get COVID in the small restaurants or the small stores, or it was, I don't know, it seemed like it was choreographed in a way. And then you look at all the conspiracy theories that are out there, you start to wonder whether they really are conspiracy theories or there's something to that. It's become more prevalent that government misinformation, disinformation could be more conspiracy theory than what they were portraying as conspiracy theory during these time periods. You got to take your vaccination. The vaccination will make it so that you can't get COVID-19. You can't spread COVID-19. It was just so scrambled up. Who knows what's really right and what's wrong? There was so much media coming from so many different directions that nobody really knew what was going on during this time period.
I think during our time here in China, it was more preventative measures. Yes, sure, there was some heavy sectional lockdowns of the city, but you had an idea what the health workers were doing, what the cases were like, because the government was sharing that data, the amount of the testing. And we talked about people expressing their concerns, whether wanting to take the vaccine or trying to understand about the vaccine. We saw people forced to take the vaccine if they wanted to keep their job. All federal government workers in Canada.
All healthcare workers in Canada. If you didn't take the vaccine, you lost your job immediately.
Wow.
Oh, yeah.
Incredible.
And then they say, we never forced anybody to.
We had some really highlighted kind of like protests, but not, I would say, more rallies to try to bring this to the attention of the government. I believe it was the
truckers convoy. All the truckers from across Canada ended up in Ottawa, downtown Ottawa, honking their horns and creating hardship for the politicians in front of Parliament Hill. And this went on for a while, and they brought in the Emergency Act in Canada, which they seized people's bank account vehicles. They took their rights away. If you contributed through a GoFundMe page to the trucker convoy, they froze your bank account.
That's extraordinary when you think that that is a US-based company with information on Canadians, which is a sovereign country, managing to share that information with the Canadian government within hours.
But GoFundMe's refused to give the GoFundMe money to the trucker convoy. I wonder what politics played in that.
Danny, was there anything of that nature down in the United States going on? Were people trying to say, hey, wait a minute, something's not right here? People were suffering. A lot of hospitals under massive pressure. Access to healthcare wasn't necessarily easy. It was pandemonium. I mean, have I got it wrong or?
Well, in the United States, during the early phase of COVID, of course, there were the massive protests against police brutality. The COVID protests were a lot smaller here, but I wasn't following it too much because what I was following was the politicization of COVID. And what we had was a really unfortunate, mainly the liberal political establishment, liberal elite. They were scrambling alongside the Trump administration to try to get a hold of this crisis. And they all went all in with vaccine only. The vaccine is going to be the solution. They did spread misinformation about that, just like they spread misinformation about masks early on in the pandemic, saying that people shouldn't really be wearing them because there were mask shortages. That was, I believe, of 2020 as the early stages of the virus was spreading. You had Anthony Fauci, who was the CDC head at the time, saying, don't wear a mask unless you're symptomatic. And that was, of course, false information, and that helped actually propel the spread. And the liberal establishment was the one protecting this because they wanted to try to stabilize things, not for poor people, not for ordinary people. They wanted to stabilize the economy for the rich. And then you had the Trump administration playing at caring for, going after Anthony Fauci, politicizing the virus even further, acting like he really cared. But he was also taking part in this huge wealth transfer as well. It was one of the big reasons why he lost the election to Joe Biden, was because the economic situation was not good. All in all, what you had was an unfortunate politicization of this whole COVID-19 experience, pandemic, and what it led to was a lot of misdirected resentments because on the one hand, surely pushing the vaccine and all of these issues of vaccine should be cared about. We should be studying them, talking about why it was so wrong to do what was done. But on the other hand, a lot of it has gone into anti-public health rather than, okay, we need to make sure that people are protected. People should not have lost their jobs. The government itself should have been responsible for taking care of people. None of that has come on the table, though. What's happened is the political elite on all sides, they decided to pull people in different directions. By the time 2022, 2021, 2022 ended, like most people here in the United States are just tired of it. Yeah, I do think that there's a lot that needs to come out, a lot that needs to be investigated. A lot of people need to be held accountable within the political establishment because it was ultimately their fault for why the crisis was as bad as it was and continues to be, because the after effects, we're going to be feeling this. We're talking about long COVID, but it's also the economic situation. Quite many years to come.
Well, basically, generally capitalization, not serving all the people, but the elites. I think that's the best line that I can say. Another thing that I wanted to point out, now that we are coming out of this initial shock to the economy, we're faced with now all these people are faced with 10 to 14 consecutive increases on interest rates. Now they're facing the government saying, wait a minute, we got to make this money back. We've spent a lot of money. We've printed a lot of money. The younger generation is going to be paying this back for decades. And I'm going to focus in on two numbers here that after talking to the doctor, there's estimates. And I mean, these are pretty staggering numbers. The number of Americans with long COVID, they're stating begins around 23 million and could be even twice that number. And according to the WHO, 36 million people across the European regions may have developed long COVID over the first 3 years of this pandemic.
Do you know how many people in China have long COVID? Like, I'm entrenched in the Chinese community because I've been living there for 20 years, and I've never heard of long COVID in China. Could it be a side effect from the mRNA vaccine? I'm fully vaccinated with Sinovac, but you don't hear of the side effects, the chronic fatigue, the heart problems, the blood pressure problems. You don't hear about all of these things in China, but you only hear about it in the Western world where they have the mRNAs. And the Chinese sort of shunned away from that. This new thing, long COVID, that's plaguing the Western world, the mRNA vaccinated Western world. I wonder if there's people that haven't had the mRNA vaccine that have long COVID, because I know in China, you don't see that, but you see it here in the Western world.
There wasn't a denial that it wasn't happening here. It's just that, and as you said, it's the way that they prepared for it and how they maneuvered through this. And generally, most Chinese were quite scared of this. So they were doing what they could and trusting in the government. I think a lot of people in the United States are suffering. There's no doubt about it. COVID's pretty much done and everybody forgot about the United States. So imagine you walk into an emergency ward in the US and say you have all these symptoms. The doctors probably say, nah, maybe you do, maybe you don't. I don't know. We can't really get much insurance for it. I mean, over to you, Kirk.
All the time I was in China, like all during the pandemic, up until June of last year, I never knew anybody in China that got COVID. Nobody, not one person. When you look back on the COVID and the deaths from COVID and strain of COVID that the Americans got, it was more deadly strain because of the quarantine, the mass testing, the isolation that the Chinese put into place. They waited until there was a less virulent strain, a less deadly strain. And then they sort of let it go wild. So maybe that made a difference because it wasn't such a mean bug by that time.
Kurt, one thing I did notice here is everybody knew what the strains were.
And if somebody in your neighborhood got COVID, everybody knew immediately. They were more cautious. In the States, it's like, you can't make me wear a mask. I don't care. Social distancing, no, that's taking away my rights. It's just two different worlds.
Well, Danny, being there in the United States, and especially the state that you're in, there is no doubt about it that people are suffering now. We are starting to see long-term COVID take shape here. The estimate 20 million to 40 million, I can understand that. I mean, this is pretty serious virus to go through your body. Did you have faith in what was going on at the time there?
No, I mean, honestly, Alex, it's much worse than that. I mean, how the United States handled this, both an absolute embarrassment and also completely intentional. My assessment of it is that it's really just how this system works. This system is not built, whether we're talking about the healthcare system or the economic system as a whole, it's not built to do what China did. China was able to prevent excess deaths and take care of people most vulnerable. The United States has been the exact opposite. And when we talk about long COVID, people wanting answers, but there are so many factors that go into why people might have long COVID. However, there's also the fact that the United States is going through not just an economic crisis, but it's also going through a social decline as well. It's going through a decline in living standards. There are so many factors that can lead to this, I would call it almost like a nexus of suffering, where you have people who are having a hard time meeting their basic needs, determining their lives. People don't trust the economic system or the political system because everything is geared toward helping and providing for the richest of people, while the poorest and even people in the middle, they are also left out or left behind. So these kind of pressures, not to mention that the US is always looking outward, always projecting or attempting to project its power outward, always looking to scapegoat, always looking to start wars and cold wars. The United States does rely on these very isolating, incredibly alienating values of individualism, and our so-called individual liberties go above and beyond the significance of collectiveness and social solidarity. So all of that put together, and you have basically a toxic soup ready to be stirred, and COVID-19 did a lot of stirring for people. It really did cause a lot of suffering, and people to this day feel like they were neglected, abused, exploited, and they've seen their conditions worsen because of it. And, the number of people I know who have lost loved ones because of it. I know many people who have long COVID. I mean, all of this is just part of daily life here. Now you have millions upon millions of people unable to work.
You use that term, toxic soup. I'm starting to think of the streets of America. These videos used to maybe come out once a year or whatever, but now they're flooding most social networks. The homelessness, the people, the drugs, the opioid catastrophe that's ripping through the United States. No wonder this number is more than 1 million people that have died of COVID.
The number of homeless people on the streets and in shelters across the U.S. increased significantly this year. That's according to a review by the Wall Street Journal, which says ending assistance programs put in place during the pandemic is contributing to the rise.
It's very difficult to count the number of people that are unsheltered, living in cars, couch surfing, in the woods or on properties that's difficult to access.
This reporting is really important because what we're seeing is that it's not just, a handful of cities, it's across the board.
One of the main things that people that work with folks that are homeless or teetering on the edge of becoming homeless said is that they are hearing quite a lot the effects of pandemic era protections running out, combined with a very tight housing market.
They fall through the cracks, maybe they lose their job, maybe they're addicted to something. But where's the family network, the community? These people shouldn't be falling. And Danny, you've nailed it when you've said that this is not only the breakdown of society. Kurt, you talked about no insurance.
These street people you were talking about, homeless people, they can't afford a home, so they've obviously got no insurance. So you're right, they're on their own. It's more than that. You see, the government is enriching the pharmaceutical companies. They're mandating these vaccinations. If you don't take this vaccination, you lose your job. You can't get on an airplane. You can't sit beside. As the governments enrich these pharmaceutical companies, they're basically sucking more money out of that society that doesn't have enough money to keep these people off the street in the first place and insure them. In China, very few people in comparison per capita suffered the COVID problem because they had policies, they had procedures, good leadership, everything that the Americans didn't have during the pandemic.
I want to add to this, Kurt and Danny, when we look at how this pandemic started to unravel, finger pointing at China. But then as we get into 2021, there's a lot of people that, first of all, then started to say, are we sure this was the origin? Maybe this was in the United States even before January of 2020?
Depends on your political affiliation.
Yeah, well, I think there's evidence that it was traveling through Spain and through Europe. And I think that there was possibly cases happening in 2019, well before the initial first case. I think it was somewhere time in February 2020. In terms of the origins, it was proliferated in Wuhan Institute of Virology, and that's usually, the U.S. government has at times, both under Trump and Biden, ascribed to this narrative. The World Health Organization has been politicized in a certain way to even be pushed in that direction at certain moments throughout this crisis. But in terms of what we know now, is we know that the origins conversation has been politicized, and it's been politicized for geopolitical purposes. It really is all about China. Some people try to say, oh, no, but the US was there. France has a stake in the lab, all this stuff. And I'm like, okay, but now you're trying to say that China is somehow unaware of some kind of dirty experimenting happening within its own labs. The origins narrative, the origins conversation, the investigations that need to happen, the US from the beginning has been politicizing it. Of course, the Western world generally just follows along. I think there's a lot of people who do truly think that it came from China, it came from the Wuhan Institute of Virology. There still are politicians, candidates, political figures who continue to promote that narrative. And it truly is dangerous. Perhaps what we need to be doing is demanding more investigation to open up these virology labs in the United States, for example, because the United States has a history of using biological weapons and all sorts of weapons.
It doesn't really matter where it came from. It's how people deal with it because it's already out there. We don't want it to happen again. I don't think that we're ever going to find the truth. I think at the end of the day, when we start to look at this isn't the last pandemic that we're going to look at. It's up to our leadership to make sure that they minimize the effects of these pandemics as they roll through.
Danny,
unfortunately, COVID-19 is just a fact of life now. The pandemic has become endemic. I think what is most needed right now is to understand and reflect of how the United States, its government, and its overall political and economic system has utterly failed the vast majority of people. All across the board, no matter where you look, people in the United States do not trust in their leadership. There's a lot of people in the United States who are losing even more trust in any kind of government intervention in any problem. What really needs to be focused on, which is how can we all together build a better future, a better society? How can we become more involved? How do we make sure that the next time something like this does happen can be addressed? How do we really assert our collective power?
Danny and Kurt, I want to thank you both. You guys have been there since day one following this. It's been very educational for me to hear you guys' opinions. And my name is Alex with Reporterfy Media. I think it's good to have collaborations throughout this community to get the message out to you guys. All right, thanks again, Danny, and thanks again, Kurt. Thanks for watching, everyone. Take care.